We live in an era where medical technology advances rapidly, offering a multitude of increasingly detailed tests and diagnoses. This revolution has saved lives and brought greater precision to the treatment of many diseases, but it has also opened the door to a silent phenomenon: the overuse of tests on people who do not necessarily need them. What should we care sometimes turns into anxiety, high costs, and unnecessary invasive procedures. Especially after the age of 70, the body undergoes natural changes, and some variations in test results no longer represent a real risk. Nevertheless, many older adults continue to be subjected to routine screenings that do not always bring benefits and can cause more harm than protection. Repetitive or clinically unindicated tests can lead to incorrect diagnoses, aggressive treatments, and even a loss of quality of life. This reality is being widely discussed by physicians, geriatricians, and experts in healthy aging. They warn of a medicine that, in seeking to predict every possibility of disease, ends up creating a cycle of interventions that are not always justifiable. Prevention is essential, but it must be intelligent, individualized, and based on real evidence, not on automatic protocols. It is at this point that knowledge becomes a tool for autonomy. Understanding which tests are truly necessary and which no longer apply after a certain age is part of healthy and conscious aging. The decision to undergo fewer tests, when well-guided, is not neglect. It is often an act of wisdom and respect for one's own body. As the years pass, the body acquires a new form of balance. Metabolism slows down, cellular regeneration changes pace, and some alterations in organs become part of natural aging, not signs of disease. Understanding this difference is essential to avoid misguided interpretations. After the age of 70, the focus of medicine shifts from aggressive screening for silent diseases to care centered on quality of life, functionality, and well-being. This means prioritizing tests when there are specific symptoms or complaints, rather than following checklists designed for younger age groups. Excessive screening can lead to unnecessary treatments, which bring risks without real benefits. Moreover, many tests, especially imaging and screening ones, generate what is called overdiagnosis, the detection of changes that would never cause real problems, but end up leading to biopsies, surgeries, or medications that negatively impact health. The goal at 70 is not just to identify diseases, but to ensure that any intervention is truly worthwhile in light of possible side effects. This shift in mindset is not about abandonment, but about precision and respect for aging. Taking good care of oneself in this phase of life requires information, dialogue with trusted professionals, and awareness that doing less with wisdom can be more effective than doing everything all the time without criteria. Subscribe to the channel. Here you will find reliable and practical content to care for your physical and mental health, disease prevention, healthy habit tips, well-being and quality of life. Turn on notifications and follow our updates to live with more balance and health. Now let's continue. The PSA test, used to screen for prostate cancer, is widely requested in men starting at age 50. However, at 70 or older, experts have been reevaluating its real effectiveness. This is because most prostate cancers evolve very slowly, and in a large portion of cases at this age, they would never cause symptoms or compromise the patient's life. Even so, a simple increase in PSA can initiate a cycle of invasive tests. Upon detecting elevated levels, the standard protocol leads to biopsies, which are not without risks. Bleeding, infections, and even more serious complications can occur, especially in people with more fragile health. And even when there is a positive diagnosis, many treatments, such as surgery or radiation therapy, can result in urinary incontinence, sexual impotence, and other severe side effects, directly affecting quality of life. Current medicine understands that, after 70, the focus should be on the patient's functional health. If there are no symptoms like pain, difficulty urinating, or relevant clinical changes, routine screening can be avoided. Living longer does not mean constantly investigating something that, in many cases, would never have consequences. The evaluation must be individual and based on real risks. This is not guidance based on negligence, but on scientific evidence. Renowned medical organizations, such as the U.S. Preventive Services Task Force, no longer recommend systematic screening in older adults. The decision to perform the PSA should be shared between doctor and patient, taking into account the real benefits and the risks of treating something that might never require treatment. Mammography has been, for decades, one of the main screening tests for breast cancer. However, after the age of 70, its continued use in women without symptoms has been widely questioned. The risk of finding changes that would never evolve into serious cancer increases, and this generates a chain of tests, biopsies, and surgeries that can cause more harm than benefits. In addition to physical discomfort, there is the emotional impact. The fear generated by a doubtful result can provoke anxiety and even lead to aggressive treatments for tumors that might never progress. In women with reduced life expectancy or other comorbidities, routine mammography can be replaced by more individualized clinical follow-up focused on well-being. The decision to maintain or suspend screening should be made based on the patient's overall health, not just chronological age. The most important thing is to understand that excessive care often strays from the real goal of medicine to preserve quality of life in a conscious and safe manner. Colonoscopy is an effective test for detecting polyps and preventing colorectal cancer, but after the age of 75, its use as routine screening has been widely questioned. The preparation for the exam is exhausting, requiring fasting, strong laxatives, and can cause dehydration, something especially dangerous in older adults. Additionally, the risk of intestinal perforation during the procedure, though rare, increases with age. For those with a clean history and no relevant intestinal symptoms, repeating this exam after 75 often does not change clinical management. Colorectal cancers usually grow slowly, and many would not develop in time to pose a real threat at this stage of life. Therefore, performing the exam without clear indication can bring more complications than protection. The current recommendation from various medical institutions is that colonoscopy be considered cautiously in older adults, prioritizing the patient's individuality. If there are no symptoms like bleeding, changes in bowel rhythm, or a strong family history, it may be more sensible to focus on quality of life and comfort rather than invasive exams without practical impact. Tests like echocardiograms, stress tests, and cardiac scintigraphies are commonly requested in checkups, even when the person shows no symptoms. After the age of 70, this can generate incidental findings, age-expected changes that end up being treated as diseases. This leads to more invasive tests, unnecessary medications, and even procedures like preventive catheterizations. These interventions, when not indicated by real symptoms, carry risks that outweigh their possible benefits. In many cases, the older adult lives well with these mild changes without needing any intervention. By turning natural variations into problems, the focus is lost on what really matters: functional well-being and quality of life. Cardiac evaluation should be based on real clinical signs, not just as an automatic protocol. An older heart can be healthy even with small changes. The most sensible approach is to monitor with attention, not investigate without concrete reason. Magnetic resonance imaging and computed tomography scans are advanced tests that provide detailed images of the body. However, when requested without clear symptoms or clinical need, they can identify small changes that pose no risk, but end up generating fear and more procedures. This is especially common in people over 70, where structural changes are expected. These incidental findings, such as cysts, calcifications, or wear, often require no treatment but become monitored with anxiety. In some cases, they even lead to unnecessary surgeries. Additionally, contrast-enhanced exams can overburden more sensitive kidneys, and radiation exposure, though controlled, accumulates over time. Imaging should serve the clinical picture, not the other way around. The conscious use of these technologies involves a careful evaluation of the patient's history, real symptoms, and the impact that the test result would have on their practical life. Seeing too much sometimes complicates more than it helps. Aging healthily is not about doing everything medicine offers, but doing what truly makes sense for your body and your stage of life. Tests that were once useful in other moments may lose relevance or become harmful over the years. Knowing when to stop with medical guidance is as important as knowing when to start. Good medicine is not based solely on detecting diseases, but on preserving autonomy, well-being, and quality of life. Avoiding unnecessary tests means avoiding aggressive treatments, preventable hospitalizations, and the emotional weight of diagnoses that would not change your routine. Taking good care of yourself is choosing with balance, awareness, and information. If this content was useful to you, take advantage of the videos appearing on the screen now. They bring other reflections and guidance on health, longevity, and intelligent choices to live with more tranquility after 70. Continue learning and caring for what really matters.